Hello everyone, my name is Savera Khan and today I will be talking about a very important topic, the connection between periodontitis and heart disease. Many people don't realize that oral health is directly connected to overall health. More specifically, research has shown that gum disease may increase the risk of heart disease. Today we will explore what periodontitis is, how it affects the heart, who is most at risk, and how we can prevent and treat these conditions. I hope by the end of this presentation, you will understand why taking care of your gums is not just about your teeth, it's about protecting your heart too. Here is a table of contents of what I will be covering in my presentation, from the introduction of the diseases all the way to the discussion questions as well as the conclusion. Before we get into the specifics of how periodontitis and heart disease are linked, let's first define these two conditions. Periodontitis is a severe gum infection that causes inflammation, damages soft tissue, and destroys the bone supporting the teeth. If left untreated, it leads to tooth loss and systemic health issues. Heart disease, on the other hand, is a broad term for conditions affecting the heart, including coronary artery disease, heart attacks, and strokes. So, why does this matter? Studies have shown that periodontitis is not just a dental issue. It has widespread effects on the body. Recent research has found a strong correlation between gum disease and heart disease, with inflammation being the common link between both conditions. This means that if we improve oral health, we may also reduce the risk of cardiovascular diseases. But how does this actually happen? Let's break it down. Let's now take a closer look at the symptoms of both periodontitis and heart disease. Symptoms of periodontitis include red, swollen, or bleeding gums, persistent bad breath, also known as halitosis, receding gums, which exposes the tooth roots, or loose or shifting teeth. Many people don't realize they have gum disease because the symptoms are often painless in the early stages. However, as the disease progresses, the infection destroys gum tissue and bone, eventually leading to tooth loss. Additionally, some symptoms of heart disease include chest pain or discomfort, high blood pressure, shortness of breath, fatigue, dizziness, or irregular heartbeat. And at first glance, these conditions might not seem related, but research shows that bacterial infections in the mouth can trigger inflammation in the bloodstream, which contributes to heart problems. Now let's talk about who is most at risk. Some people are more likely to develop both periodontitis and heart disease due to shared risk factors. High-risk groups include smokers. Smoking weakens the immune system, which reduces the blood flow to the gums, making it harder for the body to fight infections. Diabetics, uncontrolled blood sugar increases susceptibility to infections, making gum disease worse. People with poor oral hygiene fail to brush, floss, and get dental checkups, which allows plaque to build up, increasing inflammation as a result. Those with a family history of heart disease have genetics that play a role in both cardiovascular disease and gum disease risk. Recognizing these risk factors is important because it allows for early prevention and intervention. So, what exactly connects gum disease and heart disease? The main factor is chronic inflammation. When bacteria from infected gums enters the bloodstream, the body triggers an immune response. This systemic inflammation contributes to arterial plaque buildup, leading to atherosclerosis, which is also known as the hardening of the arteries. Over time, this narrows the arteries, restricting blood flow, which increases the risk of heart attacks and strokes. A study by the American Heart Association found that people with severe gum disease are 2 to 3 times more likely to develop heart conditions. Periodontal bacteria have been found inside atherosclerotic plaques, proving a direct bacterial connection between oral infections and arterial blockages. Elevated C protein, CRP levels, a marker for inflammation, are found in both gum disease and heart disease patients. This research suggests that treating gum disease could potentially reduce inflammation and lower the risk of cardiovascular disease. The good news is that both periodontitis and heart disease can be prevented and managed through lifestyle changes and medical care. Some good oral hygiene practices include brushing twice a day with fluoride toothpaste, flossing daily to remove plaque between teeth, using antimicrobial mouthwash to reduce bacteria, and regular dental checkups for deep cleaning and early detection. Some medical and lifestyle interventions include scaling and root planing, which is also known as deep cleaning, which removes bacteria from below the gum line. Antibiotic therapy helps eliminate infections. Healthy diet includes eating fiber-rich foods and avoiding sugar. Exercising regularly to improve circulation, and to quit smoking, which reduces both gum disease and heart disease risks. Making these changes can significantly reduce the risk of both of these diseases. Because the link between oral health and heart disease is so strong, we need better collaboration between dentists and cardiologists. Some key public health strategies are dentists and cardiologists should work together because dental professionals can screen for heart disease risk factors, while medical professionals could educate patients about oral health. Public health campaigns could raise awareness about the link between oral and cardiovascular health, while also promoting preventative dental care, especially in high-risk groups. Many avoid dental visits due to cost barriers, which is why you could expand dental care coverage. And also, insurance policies should include preventative dental checkups as a result. By improving access to preventative dental care, could lower long-term health care costs and prevent severe cardiovascular issues. Now that we've covered the link between periodontitis and heart disease, let's take a moment to discuss some key questions that highlight the importance of oral health and overall well-being. The first question is, how can dentists and cardiologists work together to improve patient outcomes and prevent heart disease? In many healthcare settings, oral health is often treated separately from overall medical care, but we've seen that oral health can have serious systemic effects. If cardiologists begin screening patients for gum disease and dentists assess patients for cardiovascular risk factors, we could catch early warning signs of disease. This could lead to interdisciplinary collaboration where medical professionals work together to provide better preventative care and treatment strategies. In what ways do you think this kind of collaboration could be improved in the current healthcare system? Discussion question number 2 is that should health insurance cover routine dental checkups as a part of cardiovascular disease prevention? Why or why not? We've discussed how inflammation from gum disease can increase the risk of heart disease, yet dental care is often treated as a separate expense in health insurance policies. And since oral health plays such a major role in overall health, should preventative dental visits be included in standard health insurance coverage? We should think about how reducing barriers to dental care might help prevent more serious health issues later on. Discussion question number 3 is, what are some simple ways that public health campaigns can better educate people about the connection between oral health and heart disease? Since many people don't know that poor oral health can contribute to heart problems, how can we spread awareness? Should we integrate oral health education into primary care visits? Could social media campaigns or community-based programs be an effective way to educate people? What strategies do you think would be most effective in getting people to prioritize their oral health? I encourage you all to share your thoughts and perspectives. This is a growing area of research, and the ideas can help shape future public health initiatives. To wrap up my presentation, let's review some of the most important takeaways. Oral health is directly linked to overall health, and it's not just about teeth and gums, but about preventing systemic health issues like heart disease. The key link between periodontitis and heart disease is chronic inflammation, when bacteria from infected gums enter the bloodstream, which can trigger plaque buildup in the arteries, increasing the risk of cardiovascular diseases, including heart attack and strokes. Shared risk factors like smoking, diabetes, and poor diet contribute to both conditions, which means that lifestyle changes can have a positive impact on both oral and heart health. Therefore, prevention is key. Regular brushing, flossing, professional dental care, and a heart-healthy lifestyle can help reduce the risk of both these diseases. So, what does this mean exactly? It's time for us to think about oral health as part of overall health, not just as a separate issue. Medical and dental professionals should collaborate more closely to ensure patients get the best care possible. Additionally, as individuals, we should prioritize our oral hygiene habits, and as a society, we should advocate for better access to preventative care. I hope this presentation has given you a better understanding of the serious connection between oral health and heart disease and why we need to take this issue seriously. Thank you for listening. I look forward to hearing your thoughts in the discussion week.